You're off to radiotherapy today.
2:15.
Tony has incurable cancer. He's dying, and he and his sister don't know whether it will be weeks, days, or even hours. But how he goes, well, that's very much in his hands.
My wishes need to be carried out at the end. Whatever they decide to do, they have to ask me.
It seems to me that respect, that your needs are respected, is right at the heart of this.
Absolutely. As a person. Not as a patient, as a person. Because they know what they're doing. They know how to help. They know when to help. They seem to know. They seem to have a sixth sense. They care. And they care really, really dearly.
At just 48, you could never call Tony lucky. But the nurses at the Sue Ryder Hospice, where he's cared for, have somehow made him and his sister feel fortunate, especially when they remember their elder brother's death in hospital.
I had to look after him when he needed to go to the toilet. There wasn't any nurses. They were so busy. It wasn't their fault. They were just understaffed and busy. It was just awful. There was no peace to it. It was just, it was horrible. It was horrendous.
The new guidelines hope to prevent that by calling for a stronger focus on an individual's plans, such as do not resuscitate orders. Doctors and nurses must look for signs that the person may be recovering, even temporarily. And patients should be reviewed daily, while medical investigations that are not beneficial should be stopped. If all that sounds like basic communication and compassion, the report's author told me getting it still depends on where you live.
At the moment, we don't cover the whole of the UK equally. We know that right now, not everywhere has access to specialist palliative care, whether it's specialist palliative doctors or nurses.
And that's all Tony wants now. Dignity for anyone else in his position.
That's incredibly moving, isn't it? But these guidelines are replacing the system that failed previously. Are there the resources to actually make it work?
Well, that's the question, because as you say, the Liverpool Care pathway under which patients' hydration and nutrition could be withdrawn was criticised because some families weren't told what was happening, and that's at the heart of this, a culture change. But of course, that does cost money. It requires training. Now, there's a very varying provision across our hospitals because there's no obligation on them to spend a certain percentage of their budget on palliative care. And of course, the hospices, like the incredible one Tony is in, are largely funded not by the NHS at all, but by donations. If that all sounds incredibly depressing, it is worth remembering that a very recent international survey found that despite the changes that are clearly needed, the UK still has the best palliative care in the world.